All right, according to doctors, back pain is the most common disabling pain in the country. It causes the most days missed from work. We recently met a doctor who may change the way you treat your back pain, all without surgery.
Just freezes you in your tracks, as if somebody literally just came up behind you and stuck a knife in your back.
4 years ago, Karen Edwards developed debilitating back pain. Some days it was so bad she couldn't stand up, sit down, or care for her 2 young children.
So I was on my hands and knees while they were sitting at the kitchen table, eating my food off a plate like a dog on the floor. And I just kept thinking to myself, I can't live like this. There's got to be a better way.
Millions of people know Karen's pain. Americans spend $25 billion a year trying to fix their backs. For many, the path leads to surgery. Marissa D'Souza's back pain got so intense, she was confined to bed for 8 months. That's when she decided to go under the knife.
I just want to look up, see the sky. I just wanted to stand up and walk, and they said, oh, you'll be doing much more than that.
During a 7-hour surgery, doctors put screws in her spine to strengthen Marissa's back, but it didn't help. And after a year of painful physical therapy, Marissa's back gave out again. And for the next 3.5 years, Marissa did not get out of bed. Even when guests came for dinner, Marissa could not sit up. So she was shocked when a pain specialist named Dr. Norman Marcus told her that her back problems had nothing to do with her spine.
It's like, saying the world is flat and then Columbus sails and finds it's round. It was that same feeling of disbelief. Anything here?
No.
Rather than treating the back bones on patients like Marissa and Karen, Dr. Marcus devised a way to identify muscle pain and treat that instead.
When we apply the stimulus, if there is a problem, like a trigger point, that's one of our diagnoses, it would be painful.
Dr. Marcus learned his unconventional treatment from this man, Dr. Hans Kraus, who helped cure President John F. Kennedy of chronic back pain without surgery, using a series of injections and some simple exercises. Still, 40 years later, Dr. Marcus has a hard time changing patients' notions about back pain. Most Americans' back pain has nothing to do with this.
Yes, if you took 100 people off the street, you could find in some studies 40% having herniated discs with no pain whatsoever. So because you have the herniated disc doesn't mean it's the cause of the pain.
But his patients are now true believers. After the very first visit, Marissa climbed out of bed and walked for the first time in years.
It's a miracle. It really is. It really is.
After getting just a few muscle injections and doing the exercises daily, Karen says she has her life back. And it's the active one with her family that she always dreamed of.
I have hope, and I have peace of mind. It's within everybody. They just have to tap into that to know that they don't have to live the way they are, that there is an answer.
Here's the crazy thing. Dr. Marcus doesn't use steroids or cortisone shots, just needles where he targets trigger points where the muscles attach. If you want to know more about this, log on to my blog at foxnews.com/greenroom, and I will put you in touch with Dr. Marcus's Pain Institute and his website.
That is such great news for people with back pain.
Their lives have truly been changed. All right, and coming up, McCain or Obama, who got better treatment on The View?
Gee, I wonder.